Hey everybody, welcome back to another year of Facebook Live. Thank you for tuning in here at Bloomingdale High School where the Bulls are taking on the Newsom Wolves. We're joined here today by one of our amazing sports medicine primary care specialists, Dr. Jeff Sellman. Dr. Sellman, how are you doing today?
I'm doing great, Kyle. How are you? First of all, we are excited to be on the sidelines, Florida Orthopedic, covering all these football games. We're excited to be back. It's going to be a great fall.
Absolutely, and Dr. Sellman is very experienced in concussions. He's one of our Impact Certified Concussion Consultants. It's a lot of C's in there. Basically, can you tell us what you do with Impact?
Absolutely. So Impact is a neuropsychological evaluation or a test online that we give to a lot of our athletes and hopefully most every football player here in Hillsborough County through Florida Orthopedic Institute. It is a test or an exercise for everyone to be able to see where their brain is when it's healthy for memory and reaction time. And then if by any chance they get a head injury or if we suspect a head injury, we have them take it again, and it kind of tells us where they are to see if they can go back to school, get back on a bike, kind of help manage a concussion.
Okay, and last year we talked to you about concussions. We talked to you about what they were, what the symptoms were, and we even talked about CTE, or chronic traumatic
Encephalopathy.
Absolutely.
Big word.
But we want to kind of go a little bit deeper today. We want to talk about the myths, maybe dispel some myths, maybe prove some are actually true, fact or fiction. Does that sound all right?
That sounds great.
All right, so here's a scenario. We have one of our athletes are running down the field. They get a hard hit to the head, but they don't get knocked out. They continue playing. Do they not have a concussion because they weren't knocked out?
Absolutely not. You do not have to be knocked out. You don't have to be knocked unconscious in order to have a concussion. Because by definition, although concussion is a mild traumatic brain injury, there's not a structural damage to the brain or the head itself. So you can just have a knocking around of the brain, so to speak. I kind of equate it to, an egg and the yolk inside the egg. If you shake it hard enough, it's probably going to affect the fluency of that egg. That's what it does to the brain as well. So no, you do not have to be knocked out in order to have a concussion.
Okay, there you go. How about if you get a concussion? If that athlete was concussed, is it easier for him to get a concussion?
If you were to have one concussion, it does elevate the risk to have another one again in the future. What that risk is, we don't know for sure. We don't know how many, in other words, in a year's time, the velocity. Do you have one, two? Does that make you more susceptible to more in the future? We don't know for sure. Still, a lot of those questions need to be answered.
Okay, and let's talk a little bit about regulations. We see that in professional football, they keep changing the rules, maybe moving the kickoff point to a little bit further up the field, making it a shorter distance, making it so the athletes don't get that much of a running start, kind of lessening the, chance for injury. Do we see any kind of lessened probability of concussions with changes in regulations and rules?
A short answer to that is there are fewer concussions, or we hope there are fewer concussions associated with the change of rules. I'll have to tell you, there's just concussions are a hot topic. We have made it so. Media has made it so, which is fair. So a lot of this research is going in to see what can change, and then we have to find out maybe a couple years later to see if that actually did decrease concussions. But everything is for the good of the athlete that we can possibly do to help protect them in a collision sport such as football.
Okay. And who is involved in the overall care process of a concussion? Is it just the athlete gets concussed, talks to the trainer and talks to you and does the impact test and that's it? Or are there more professionals involved?
So there is a team of professionals that should always be involved, especially for a concussion that may last longer than 2 weeks. First and foremost, a shout out to all of my athletic trainers because they are still the most important part of our sports medicine team because they are on the front lines. They're the ones who evaluate, who treat immediately, who see, who hold the patient out or the athlete out. When they come to see me, then it is my job to determine what kind of concussion they have. There are a lot of clinical trajectories. There's a cervical part of the concussion, a personality component where their personality changes, an emotional component, tracking difficulties associated with their vestibular ocular motor cortex is very important to assess. So taking all those together, people that are then further important to bring in, depending on the athlete, a chiropractor for gentle manipulation, because we forget most concussion comes with a whiplash component for the cervical spine. An ophthalmologist, if they're having tracking issues of their eyes, to help treat or maybe even get some glasses or a patch to help short term to bring them back to baseline. Physical therapists in their vestibular retraining, and finally some neuropsychologists who might be able to help with the emotional component of a concussion.
That sounds like quite the team in caring for a concussion. Lastly, we just want to know, if you get a concussion, so we see you after we get a concussion, right? And the chances are a little bit more increased, so to speak, if you get a concussion, we said?
So yes, so in other words, a subsequent concussion, the chances are increased if you have had a previous one. Is that the question?
Yes.
Yes, then yes it is.
Is there any, we talked about rules and regulations, but are there any equipment changes that we see? Helmets, maybe even mouth guards? Do mouth guards help decrease concussions at all?
That is a great question. Mouth guards have not been proven to make any difference in concussion severity or in concussion frequency. So still use them. They certainly will help with protecting the teeth, but not with protecting someone from a concussion. Tons of research around the country, especially fueled by the NFL, for different kinds of padding, different kinds of components to a helmet, different fittings, and we have yet to see some that are coming out full mainstream, but we're excited to see when they do.
And is it ever too late to get checked out? If you have a concussion, maybe you don't really feel that many symptoms, but a week down the line, you kind of start to get a headache. Is it ever too late to get checked out?
Never too late to get checked out. Of course, my philosophy is try to stay away from doctors if you can, because we are meant to find something wrong with you. However, I'll give you a little story real quick. We had an athlete at a local university that did have a concussion. He was deemed to be capable to go back after performing the return to play. He ended up getting a little worse, and so then I got involved. And then that is maybe a month out from his original concussion. We got him a lot better. It took him a little bit longer, but it is definitely never too late to get checked out.
All right, well, you heard it here first. Dr. Sellman, thank you so much for joining us today. We interviewed him last year, like we said previously. You can find those videos on our Facebook and on our YouTube. Be sure to subscribe to our YouTube. We're only 50 away from 1,000 subscribers, so we're really excited to hit that milestone. Dr. Sellman, once again, thank you so much.
Thank you, Kyle.
We'll see you next time.